Hi all, Muhammad Al-Mala here. I wanted to share with you another video of a tube occlusion procedure using a prolene suture to intracamerally plug the tube. Now the indication for the surgery would be hypotony from overfiltration through the tube, and so we want to restrict the flow through the tube. 10 years ago, what I would have done is I would have opened up the conjunctiva, located the tube, and tied a suture around the tube to decrease flow. But now with using this tube plug procedure, really the surgery is much quicker and shorter than before. And the idea here is we're going to thread a prolene suture up the lumen of the tube. And this is an unedited video of this procedure, and I just want to take a few minutes and share this with you. So I've tried different sutures to occlude the tube. 2-O-prolene pretty much 100% of the time provides a complete tube occlusion, and I thread the prolene up the tube lumen from across the anterior chamber. Here in this procedure, I'm sitting superiorly, and probably the ideal position is to actually sit temporally, but nonetheless, you'll see the procedure is not really technically challenging. So in this case, I elected to sit superiorly. In any case, I've made 2 paracenteses so far, one temporally and one inferiorly, 180 degrees across from the tube. I'm going to ask my scrub tech to hand me a portion of 3-O-prolene. So as I was saying, I've used different sutures for this. If you use 2-O-prolene, it's going to provide complete tube occlusion. If you use 3-O-prolene, it'll provide partial occlusion. Unfortunately, in these tubes, especially the non-valve tubes, it's pretty hard to titrate, I've found. It's either you get complete occlusion with really high pressure, or you don't get much of an occlusion at all. And the 3-O-prolene has been, in most cases, a good compromise. I think the more you're able to thread the 3-O-prolene up the tube lumen, the more it's going to restrict flow. So in this case, I've elected to use 3-O-prolene, and the 3-O-prolene does not completely restrict flow. And here we're just injecting preservative-free lidocaine. Let's move this along a little bit here until we get to the part where we actually get the prolene on the field. So we inject preservative-free lidocaine, and then I'm going to use a cohesive viscoelastic in the anterior chamber. And then we're going to thread this prolene suture up the lumen of the tube. And you can see here, it really threads up the lumen of the tube quite nicely. And you can see it subconjunctivally there. And I thread it up as far as it'll go. The tube may not be routed directly into the anterior chamber, so it may hit a bend in the tube and not be able to be advanced any further. And what I'm doing here is, as you can tell, I'm just trying to see if I can get that tube to go in a little bit further. Let's see if we can watch this more in real time. So at this point in time, I'll go in with the IOL cutting scissors, and I will trim. And I'll trim that prolene suture. I'll leave some of it extending beyond the tube, so that we can later, if need be, remove that prolene suture from the tube. But that's essentially the procedure. You thread it up the tube lumen and then pull the suture out, and then that's really about it. The further you thread the 3-O-prolene, or you're able to thread the 3-O-prolene up the tube lumen, probably the more resistance you're going to get to outflow. And I'm just going to use some BSS to irrigate out the viscoelastic from the anterior chamber. And that's really about it for the procedure. And then we'll hydrate the wounds and make sure they're watertight. Irrigate as much viscoelastic as possible. Let's just fast forward here. In essence, that's the entire procedure. We've achieved what we want to achieve. So, when it comes to tube occlusion, or if you have an overfiltering tube or chronic hypotony, this is one way to occlude the tube. If you want to achieve complete occlusion, use a 2O prolene suture. If you want to achieve partial occlusion, but perhaps you may not get the pressure to be quite as low as what you, the pressure to come up quite as much as what you'd like, you can use a 3O prolene. I have in fact actually exchanged a 2O prolene for a 3O prolene in the past. I had a patient with chronic hypotony, severe hypotony, 0 or 1 millimeters of mercury. I put in a 2O prolene initially. The pressure went up quite a bit into the 40s. Once I was confident that the patient was ready to go back to surgery, a few weeks later after the patient had been on drops, I went back in and exchanged the 2O prolene for the 3O prolene. And the patient's pressure maintained in the mid to high single digits. So 3O prolene can definitely still cause some overfiltration. I think the more you're able to thread it up the lumen of the tube, the less, probably the more resistance to outflow that you'll get. So in any case, I just wanted to share this video with you. One way to occlude the tube is to thread a prolene suture up the tube lumen, and it can be a relatively short, although it can be a relatively short procedure. One thing to keep in mind is you want to do this procedure. Obviously the patient here is pseudophakic. Obviously, if the patient is phakic, you want to be aware of the lens. If the patient is aphakic, which I have done in the past, that procedure, it's obviously we put in viscoelastic. You're not quite as able to pressurize the eye because of the eye being a unicameral eye. So if you have any questions, comments, thoughts, if you've done this technique, if you've used different types of suture, please leave the comments below. I'd love to hear from you. Thank you very much and have a nice evening.